In my last video, we looked at what causes male pattern hair loss, also known as androgenetic alopecia, and busted some of the biggest myths surrounding it. But there is still a huge amount of confusion about which treatments actually work and which ones are simply marketing gimmicks. So, in this video, let us clear things up by examining all the scientifically backed treatment options that can truly help those of us dealing with hair loss. A common question I get from men is, I don't want to use medications for hair loss. Isn't there something natural I can try? To answer that, it's important to understand that androgenetic alopecia itself is a completely natural process. Even men who live incredibly healthy lifestyles, who eat well, exercise regularly, and don't smoke can still go bald if their genetics are programmed to gradually switch off hair growth as they age. In other words, fighting male pattern hair loss means swimming against the biological current. You're trying to stop something the body naturally wants to do. That's why so-called natural treatments often disappoint. Although there are countless supplements, oils, and shampoos on the market that claim to prevent or reverse baldness, the science behind most of them is weak at best. Multiple studies have shown that dietary supplements don't help with male pattern hair loss unless a person actually has a nutrient deficiency. For instance, one study recommended vitamin D or iron supplementation only for individuals with proven low levels. But for the average healthy man with a balanced diet, deficiencies are rare. Unless your diet is extremely restricted or you have a medical condition that affects nutrient absorption, popping extra supplements is unlikely to make a difference. What about shampoos and topical treatments that promise to regrow hair? Some products contain ingredients like saw palmetto, caffeine, or ketoconazole, an antifungal agent. While there are a few small studies suggesting potential benefits, most of these trials have major limitations. They often lack control groups, use vague or subjective measures of success, or involve only a small number of participants. Because of this, none of these ingredients have been elevated to the list of standard or proven treatments for hair loss. If you decide to try them, it is best to keep your expectations low and view them as optional additions rather than core treatments. On the other hand, there's one lifestyle factor that's been consistently linked to faster balding: smoking. Multiple observational studies show that men who smoke cigarettes tend to lose their hair earlier and more quickly than non-smokers. Smoking affects blood circulation, damages DNA, and increases oxidative stress, all of which can negatively impact hair follicles. So, if you're serious about protecting your hair, quitting smoking is one of the most effective natural steps you can take. Now, let's get into the scientifically proven treatment framework for hair loss. Remember from the last video that in androgenetic alopecia, hair follicles gradually shrink over time until they stop producing visible hair. As the number of active follicles declines, bald areas begin to appear. There are two main categories of treatments. First, hair loss stabilizers, which aim to keep existing follicles alive and in some cases even reactivate smaller ones. And second, hair replacement options, which restore coverage in areas where follicles have already died. The two most established stabilizers are Minoxidil and Finasteride. These are considered first-line medical treatments and work best when started early, ideally as soon as you notice your scalp becoming more visible. By that stage, around 50% of your hair follicles may already be gone, so early intervention really matters. Minoxidil, commonly available as a 5% foam or lotion, is applied directly to the scalp twice a day. It works by increasing blood flow to the hair follicles and prolonging their growth phase, effectively rescuing them from dying out. Over 99% of the medication stays on the scalp, with minimal absorption into the bloodstream, which makes it very safe with few systemic side effects. The most common issue is mild scalp irritation or itching, which tends to improve if you use the foam instead of the liquid version. Minoxidil works for many, but not all men. Studies show that about 15% of users experience noticeable hair regrowth, while around 2/3 see stabilization or slowing of their hair loss. Unfortunately, roughly 1/3 of men continue to lose hair despite regular use. Two concerns often come up with minoxidil. First, an initial shedding phase, where hair appears to fall out faster in the first few months. This happens because the treatment pushes hair follicles into a new growth cycle, temporarily increasing shedding before stronger hairs start growing. The second issue is that minoxidil must be used continuously to maintain results. Since male pattern baldness is a natural ongoing process, stopping treatment allows hair loss to resume. Next up is finasteride, an oral medication that works differently. Finasteride blocks an enzyme called 5-alpha reductase, which converts testosterone into dihydrotestosterone DHT, the hormone responsible for shrinking hair follicles in men genetically prone to baldness. By lowering DHT levels, finasteride slows or even reverses the miniaturization process. It's generally considered more effective than minoxidil. About 2/3 of men experience visible regrowth, and nearly all others see stabilization. Only around 1% of users don't respond at all. Finasteride is taken as a 1 mg tablet once daily, and it usually takes at least 2 years to see maximum benefits. Like minoxidil, its effects last only as long as you continue using it. Stopping treatment will allow DHT to rise again, restarting the hair loss process. One major concern men often have about finasteride is the potential for sexual side effects such as reduced libido, erectile dysfunction, or changes in ejaculation. The best data we have comes from a 2010 meta-analysis that reviewed 12 clinical trials comparing finasteride with a placebo. In the placebo group, 3 out of 100 men reported sexual side effects. Among men taking finasteride, an additional 2 out of 100 experienced them. So, while these side effects do occur, they're relatively uncommon. There are also some reports of long-term symptoms persisting after discontinuation, known as post-finasteride syndrome, but these cases appear to be rare. Ultimately, each person has to weigh the small risk of side effects against the potential benefit of keeping their hair. Some men ask whether lowering the dose can reduce side effects while maintaining benefits. In fact, early studies found that even low doses of finasteride down to 0.2 mg per day can still increase hair counts compared to baseline, although not as much as the standard 1 mg dose. Because of this, some experts recommend taking 1 mg 3 times per week as a compromise. However, this should only be done under medical supervision. You might be wondering whether combining finasteride and minoxidil gives even better results, and the answer is yes. Studies show that using both treatments together can provide superior outcomes compared to using either one alone, especially for men with more advanced hair loss. For men who have already lost large areas of hair where follicles are no longer active, medical treatments alone won't bring those areas back. In that case, hair replacement options become the next step. The two main ones are hair transplant surgery and camouflage products. Hair transplant surgery is a clever solution. Men with androgenetic alopecia retain a rim of hair at the back and sides of the head. These follicles are genetically resistant to DHT. In a transplant, a surgeon moves some of those healthy follicles to the balding areas. The results can look completely natural when done skillfully, though it requires a trained professional and can be expensive. Transplants are often combined with ongoing minoxidil or finasteride use to preserve the remaining native hair. For those who prefer non-surgical options, camouflage products can be surprisingly effective. These range from spray-on concealers and fibers that make hair appear thicker, to custom hair systems that blend seamlessly with natural hair. Finally, there are some emerging therapies showing promise. Low-level laser therapy LLT, platelet-rich plasma PRP injections, and another medication called dutasteride are all being actively researched and have shown early positive results. If you'd like a deep dive into any of these newer treatments, let me know in the comments. In the meantime, remember, Fighting hair loss isn't T about finding a miracle cure, it's about combining proven treatments, making smart lifestyle choices, and setting realistic expectations. Thanks for watching, and I'll see you in the next one.